How long did it take you to limber up from that stiffness in the morning? At the very beginning?
Within a matter of weeks, Marjorie and Gary Deem's world was turned upside down.
This was like a pain that was constant. It wouldn't go away. My joints began to really be swollen, and it was a constant pain. I couldn't lay down. I couldn't stand up. It was just frustrating, and it was a struggle just to do anything.
She would sleep sitting up, and nobody should have to go through this.
Rheumatoid arthritis, also known as RA, can leave many people feeling helpless and often depressed. If left untreated, swollen, painful joints and fatigue can put a strain not only on the person living with the disease, but often on his or her caregivers as well.
The part that's really tough is to see her go down, the decay of her personality, of her physical being.
All types of arthritis will cause some type of problem with pain, swelling, and stiffness of joints. The additional thing in rheumatoid arthritis is that people can feel poorly. They feel ill. They're fatigued. They just do not feel themselves. They have lost their energy.
Doctors say there are some unknowns regarding rheumatoid arthritis, and researchers are debating whether it's one disease or several different diseases with common features. What is known, however, is the role that the body's immune system plays in RA.
The immune system is supposed to be our friend. It is supposed to be protective of anything that affects us from the outside, infections, bacteria, viruses, etc. But sometimes the immune system does not function the way it's supposed to. And when that happens, you can have what is called an autoimmune disease. In essence, our immune system is turning against us and therefore causing diseases that are really a factor of the immune system. Instead of fighting outside invaders, fighting against something internal.
This immune system reaction causes inflammation and pain. Not only can RA affect joints in the body, but it can also spread to other organs like the heart, lungs, and kidneys for chronic and severe patients. Treatment methods focus on relieving pain, reducing inflammation, and stopping or slowing joint damage while improving joint function. Managing the signs and symptoms of RA has long been the standard treatment strategy. But doctors say the combined effects of new biological therapies and early diagnoses have significantly increased their success rate in treating RA patients.
We can maybe even achieve remission. We can avoid the late-stage damage and deformity that does occur, and you diagnose early and you treat aggressively.
Marjorie Deem participated in a clinical study. It took a couple of months, and the changes were gradual. But each day, her improvements gave her the encouragement to keep going.
I went from the lowest point of my life to being probably the luckiest person and the most fortunate person. I'm able to do everything that I've done before. I'm able to be a wife to my husband and take care of him. And we can go dancing. We have a way to go, but we live a full life. We live each day like it possibly could be our last day. I've learned that, not to take too much for granted anymore.
It's almost like that part where she was down, those couple months, that year and a half, till everything started to go the good way. That part of our life is almost like it wasn't even there. You know, we moved on to the next chapter.
Rheumatoid arthritis remains a complex disease, and there is much to be learned about its prevention and cure. But research continues to yield many insights. Scientists and physicians are making real progress in understanding RA, and the results are having an impact today, enabling many patients to remain active in their family and work lives far longer than was possible just a few years ago.